Is like, why is diagnosis of adenomyosis so delayed? So one thing is that there's no strict criteria, either on ultrasound or MRI, to diagnose adenomyosis. On ultrasound, we have direct and indirect features, and many of us are not trained to pick up those. And on the MRI, the most important thing which you would rely on is junctional zone, which is again very questionable. And on pathology, we know that we miss the diagnosis of adenomyosis because of the need of sectioning the very thin slices, which is a very tedious process. So what's the solution for it? The solution is listening to the patient, because most importantly, the symptoms of the patients do correspond to the diagnosis. And relying on ourselves for diagnosing adenomyosis, making ourselves more adept to recognizing the sudden direct and indirect features on the ultrasound and the MRI. So reading more ultrasound yourself, training yourself, going in these conferences, and getting to know what are the direct and indirect features. And also asking for the pathologist to rule out adenomyosis. One important thing is that there's a light at the end of the tunnel. In this conference where we had people from all over the world, they're talking about how to use AI so that we don't miss the diagnosis of adenomyosis. How do we train ourselves so that we don't miss the diagnosis? And more clinicians should be ultrasonographers. And that's what we do this.